Hi guys, and welcome to the last episode of our photography series. In the last episodes, I covered equipment and settings. In this video, I'm going to share my technique for getting all the standard shots, and I'll give you loads of tips along the way to make it as easy as possible. Let's get right into it. By now, you should have all the settings for both portraits and intraoral shots, which we discussed in the last episode. So let's start with portraits. You can hang a black theatre cloth or a blackout blind on the back of your door, or just ask your nurse to hold it behind the patient. If possible, both you and the patient should be sat on a chair so that you can adjust your height to be at eye level to the patient. There should be roughly 1.5 meters distance between you. Set your camera settings to the ones you worked out from the previous video and hold the camera in portrait mode. Ask your patient to look straight into the lens and take the photo using autofocus. Now, moving on to the intraoral photographs. Change your settings to the intraoral ones you found earlier and change your focus to manual. For the basic intraoral photographs, you should set the focus ring to 1 to 3. This means you don't turn the focus ring to focus on the tooth. Rather, you move your body in and out until the tooth is in focus. The reason we do this is that so we can control the size of the picture. If you always take your basic intraoral photos with a 1 to 3 magnification ratio, your before and after photos will consistently look the same size. But if you move the focus ring and take them with a different magnification ratio, the two images will be different sizes and you will have to crop one of them. For all your basic intraoral photos like the anterior, side view and occlusal, use a magnification ratio of 1 to 3. For your posterior quadrant photos or close-up photos of the palatal or lingual surfaces, use a magnification ratio of 1 to 1.5. The key here is consistency. If you prefer, you can just take all your photos at 1 to 3, or you might prefer to take all your posterior quadrant photos at 1 to 2. It doesn't matter as long as you stick to that magnification ratio for your before and after photo. You should also turn on the modeling light if your flash has one. This lights up the area as you're trying to take the photo so you can see better and makes it much easier to focus. This might be a bit annoying for your patient, so ask them to close their eyes. Now, in terms of patient positioning, I like to get the patient to sit in the dental chair and I raise the chair up to a height that's comfortable so I'm not bending over too much and so that my camera is parallel to the surface of the anterior teeth. Now, a mistake that most people make is that they ask the patient to rest their head on the headrest. This actually makes it harder, and when you take a photo, their occlusal plane is going in the wrong direction. It makes them look sad. You should ask your patient to look straight at you, which usually means they have to tilt their head a bit to the right, and ask them to tilt their chin down if needed until you can see the occlusal plane is going naturally upwards. Once you're happy with the positioning, move your whole body slightly back and forth in a rocking motion until you see the lateral incisors are in focus. Once you're in focus, take the shot. As you get more and more experience, this should be very quick. When you ask your patient to smile, they can normally hold the natural smile for only a few seconds. Any longer and their muscles start to fatigue and the smile looks unnatural and forced. If you need to, ask the patient to close, have a rest, and then try again. This way, you'll get a more natural smile shot. Now, before I move on to the next shot, I'd really appreciate it if you gave this video a thumbs up. It really helps our channel grow and reach more people. Thank you. Next, I like to get the retractors in and ask the patient to hold them. I prefer my patients hold them because they know best themselves how tight to pull because they can feel it. Sometimes nurses can be too gentle, so you won't get the best retraction. Ask the patient to hold the retractors outwards towards the camera as well. If you don't do this, you tend to get bowing of the upper lip, which shows up in your photo. When you're ready to take the picture, ask the patient to bite and breathe in, and I take the photo using the exact same principles as the last photo. Breathing in helps prevent these air bubbles in the interproximal regions, but if they still show, you can gently dry the teeth with a cotton wool or a 3-in-1 spray. Ask the patient to slightly open so you can see the incisal edges of the upper and lower teeth and take this shot. If you're planning to do work on the anterior teeth, this would be the time to take pictures with a contraster. Ask the patient to hold the retractor slightly upwards so you pull the upper lip higher. Place the contraster in the mouth parallel to the upper occlusal plane and then slightly tilt it down so that the contraster isn't touching the incisal edges. If the contraster is too close to the incisal edges, you might get the reflection of the teeth instead of a pure black background. If you went down the route of setting your flash on TTL automatic mode, which we discussed in the last video, you might struggle with contraster shots because the camera will see the black contraster and think it will need lots of flash to lighten it up, and your photo ends up being too bright. My advice would be to shoot with manual flash settings, or change the flash exposure compensation setting on your camera to -1 or -2. You will need to look at your camera manual on how to change this setting. The exact same principles apply for the lower shot with the contraster. Just ask the patient to pull slightly downwards to pull the lower lip out the way. For the lateral views, I ask the patient to tilt their head towards one side and pull the retractor harder on the side facing me, and relax the cheek retractor on the other side. Again, pay attention to the angle of the patient's head and ask them to tilt their head up or down if you need the occlusal plane to look right. Then you want to move in and out until the second premolar is in focus and take the shot. Do the same for the other side. Now, if you find you're not able to get the last molars and this is something you want to capture, then you will need to use the Buccal mirror to get these Buccal shots. Firstly, if you're going to use a mirror, you need to prevent it from fogging up in the patient's mouth. Easiest way is to warm up your mirror with warm water before you start taking photos. Another method is to have your nurse blow air from your 3-in-1 spray onto the mirror. And if all fails, you can ask your patient to hold their breath or take a deep breath through their mouth as you're taking a photo. Even if I have warmed my mirror, I generally tell my patients to breathe in and out through the nose when I'm taking photos. Now, when using mirrors, you can either ask your nurse to place them in and you can guide them, or you can hold the mirror yourself. Depending on how comfortable you feel and how light your camera setup is, you can decide. If you're able to practice and get used to holding the mirror yourself, then I think you should. It means you'll be able to consistently take photos yourself without having to rely on your nurse knowing how and where to hold the mirror, because they can't see what you can see on the camera. So it's actually very difficult for them if you don't guide them properly. So again, ask the patient to pull the retractor with more tension on the side you're taking a photo, place the mirror parallel to the buccal corridor, and then tilt it outwards so that the mirror is at a 45-degree angle to the teeth. Once the mirror is in place, it might be easier to ask the patient to remove the retractor on that side so you can tilt the mirror properly. Try to avoid resting the mirror on the alveolar ridge because it can be quite uncomfortable for the patient. So try to get ready quick and take the photo at a 45-degree angle so you have an ideal 90-degree angle to the teeth, and do the same on the other side. Now, whilst the patient is in this position, you can take the lower lingual shots at the same time. You can either use this side of the buccal mirror or this side of a lingual mirror for this shot. The curve on this mirror helps you place the mirror lingually and stops the mirror catching on the incisors. For these shots, you might want to change the magnification ratio to 1:2, so you don't have to do too much cropping after. So slide the mirror in between the teeth and the tongue and go all the way to the retromolar pad, and angle the mirror towards the canine and push the tongue out the way. Then take the shot. Now, since the mirror is in this position, it's convenient to just tilt the mirror upwards so you can get the upper palatal shots on the same side. And do the same on the other side for both the lingual and the palatal shot. At this point, the only photos that are left are the occlusal and posterior quadrant photos. And for these, it's much easier to have the patient laying flat and at a low height, and set your magnification ratio back to 1:3. For the occlusal shots, you can either carry on using retractors, but I find it difficult to get the mirrors in, so I prefer to use lip retractors like this one. This makes sure that the lip doesn't roll over the occlusal surface of the teeth. Once the patient is flat, ask them to tilt the chin upwards and open wide. One of the main reasons most people struggle with occlusal shots is that they don't have the patient completely flat at a low height, and they don't ask the patient to tilt their chin, so their view is very limited. So make sure you follow these steps. Next, put the lip retractor in and place the mirror in as far back as possible near the maxillary tuberosity, and tilt the mirror as much as possible. My advice for these shots would be to just look at the mirror and make sure you can see with your eyes what you want to capture properly before bringing the camera to your eyes. It's very difficult to adjust or instruct your nurse when you're looking through the viewfinder. When the position of the mirror is correct and it looks great to your eyes, then bring up the camera and take the photo. When taking these occlusal shots, don't have super high expectations of capturing the wisdom teeth or the second molars. A good occlusal view should capture up to the distal of the first molar. It's much easier to capture the occlusal surface of the second and third molars in the posterior quadrant photos. Now, for the lower occlusal, again, ask the patient to tilt their chin up, open wide, and get the lip retractors in. If possible, ask them to put their tongue up to the roof of their mouth and get the mirror in to prevent the tongue from going on the occlusal surface of the molars. This might be too uncomfortable for some patients. In that case, just ask them to relax their tongue. Place the mirror as far back as the retromolar pad and tilt the mirror as much as the patient allows. Then take the shot. With this one, you want to be fairly quick because it's quite uncomfortable for the patient. At this point, you can switch to the buccal or lingual mirror to get the posterior quadrant photos. Set your magnification ratio to 1 to 1.5 and get the retractors back in. Ask the patient to move their tongue to the roof of their mouth and place the mirror in as far back as the retromolar pad again and tilt as much as possible and take the shot. Do the same on the other side and then move back behind the patient to take the upper posterior quadrant shot. When taking these shots, the positioning of the mirror is very important. You want the mirror to be at a 45-degree angle and angled so that you can see the occlusal surfaces of the teeth. If you angle it poorly, you end up getting more of a palatal view or lingual view, which you don't want. And that was it for this series, guys. I hope you found it useful. A lot of effort went into this series, so if you enjoyed it, please give the video a like and subscribe. If you have any questions, put it down in the comments and we'll get back to you. If you guys want to see more advanced dental photography like this, put it in the comments and maybe I can make a video about that as well. Thank you all for watching. Take care.